All right. Hello, everyone who's present here for the live session. Since we have the Mental Health Awareness Month going on, we planned this session especially for people who want to understand more about the basics of mental health and how to, reach out to people for help and ask for help. So, to begin with the session, we will be having Dr. Rashi who will be joining us for the session. She's an MBBS and MD in psychiatry, and we'll just add her. So, Dr. Rashi would be joining us in a moment.
Hello,
Hello, doctor. How are you?
I am good. How's everybody? Thank you so much for having me and giving such a big platform to talk about something that is so important.
Yes, mental health as a topic in itself is a very sensitive topic, and we are just inspired by professionals like you who are talking about it more about the basics and also destigmatizing the myths that are associated with it. So we're really happy to have you here. So we will just introduce Dr. Rashi, and then we would want her to share her journey as well before we begin with the questions and take up the questions from the comment section. So Dr. Rashi is an MBBS and she has an MD in psychiatry. She also received the HT She Slays Award for her contribution. She creates a lot of content around the fundamentals of mental health awareness and also a lot of content around busting myths related to mental health, which we would be covering in today's session. So, Dr. Rashi, would be really excited if you could share more about what inspired you to start this journey and how you began with, influencing people and forming the safe community for them to share how they feel about it.
Uh, I would just start by saying I literally live and breathe mental health. So I am really passionate about how much mental health is affecting our each and every part of life. So it's not just something that is very momentary that, okay, today and tomorrow, that is just like a lifestyle. So like we just take care of our physical health. Similarly, we have to take care of our mental health on a day-to-day basis. So it's a journey and it's never like it never starts and it's never ending.
Yeah.
So what inspired me that when you're working in an offline setup like pre-COVID and you're just seeing same things again and again, day in and day out, you realize that there are so many questions that everybody is having and they're very similar and they're unanswered. That inspired me to start the page and start talking about very common things because I felt that I was just going on a loop there, that I'm explaining the same things again and again. And see, from within the community, when we think that a lot of people know these kind of stuff. But when you go on the ground level, you work in tier 2, tier 3 cities, you realize that you have to like literally start again from the very ground basic. People are not aware because again, XYZ reasons, we are not taught. So again, how would we?
Okay, that's great. That I hope that helps everyone to just understand her journey. We would be taking questions primarily from what we've received earlier, and then we would love to take up questions if you have any. You guys can always leave the questions in the comments below. We had another session in October where we had an amazing psychologist on board, and she explained us more about psychotherapy. In this session, we want to understand more about what is the difference between the two, since people have physical symptoms as well as psychological symptoms that they need to address while taking help. So, could you help us understand the difference between the two and what are the basics of that?
Okay. So psychiatry is a branch. It's not a therapy. It's not an illness or anything. So like a person is a gastroenterologist. A person is a nephrologist, like specializing in stomach or kidney issues, something like so. Psychiatrist is a person who deals with mental health. Is a doctor who deals with mental health. So psychiatrists are trained to write both medicines as well as therapy. So psychiatrist is the person technically should be your first point of contact because they are trained and licensed to give you uh, diagnosis clinical advice as well as advise you medicines and or therapy, whatever is suiting you in that situation. Psychotherapy is something that is therapy, which generally therapists do more. So it's like understanding your mind, having a good conversation. So most common psychotherapy is CBT, which we say is cognitive behavior therapy. So it's not just talking and listening to one another. The therapist gives you, first of all, a very outside perspective of what's happening.
Right.
And you're able to see things with a clearer lens. And it's not a guide, like they would not guide you that do this, do that. They would help you to come out with solutions or to kind of analyze the situation yourself, because see, ultimately you are the best person for yourself and you can make the best decisions. So yes, so psychiatry is a branch and things come under it, and psychotherapy is also something that comes under what a psychiatrist can do.
Right, right. That's quite helpful. So, uh, while a person may be having some physical symptoms, is when you recommend that you go to a psychiatrist in terms of understanding what they're going through mentally, and if it does not reflect on them physically, do you suggest, if accessible, a person should go to a psychiatrist first or a psychotherapist, or is it recommended to visit both after consulting a psychiatrist?
See, because we know the kind of stigma that exists in the society and the actual
Right.
state, the ground happening. Uh, in ideal situation, the person should be in first contact with the psychiatrist, but not very hard and fast rule, because they would give you a clinical diagnosis. They can advise you what is the right for you in that situation, whether you need just therapy, whether you need just medicines, or whether you are in requirement of both. But yes, seeing what's happening around and the amount of less awareness that we have, it's ideal that you go to any. Like, we just want the person to reach out and seek help. A lot of therapists also work with psychiatrists. So, in case they have a person who comes to them and they feel that's beyond what they can handle or beyond what services they can provide, so generally they refer them to a psychiatrist. So, I work with n number of psychotherapists or therapists, and they advise me or they send me patients as per they feel that okay, the therapy is not enough for them and they might be requiring medications or they might be requiring some clinical tests, some evaluations, or a clinical diagnosis. So ideally, uh, things do not work. We just say that if you are in that state and you feel that you need help, just go out and seek help anywhere. A lot of people want us to talk in Hindi, तो मैं इसे थोड़ा सा ना एक बार हिंदी में भी explain कर देती हूँ.
Sure, we would
किसी
love that.
किसी को भी दिखाओ, आपको थेरेपिस्ट के पास जाना है, साइकाइट्रिस्ट के पास जाना है, बस आप एक बार वो स्टेप लो और आप अपने हेल्थ की जर्नी शुरू करो. उसके बाद से आपको एक रास्ता मिल जाएगा, एक नेविगेशन या एक गाइडेंस मिल जाएगी कि अब आपको क्या करना है. बिकॉज ऑब्वियसली समथिंग इज बेटर देन नथिंग. यही सोचने में कि यहाँ जाए, ये करें, ये करें, ये करें के बजाय जस्ट गो. बिकॉज एनी डे यू स्टार्ट, वो अच्छा ही रहेगा कि वहां से चीजें बेटर होनी स्टार्ट होंगी. एटलीस्ट क्लैरिटी तो मिलेगी.
So true, so true. And just like Dr. Rashi mentioned, before you understand the difference between the two and look forward to who you should visit first, just understand and recognize that you need help. And it is always good to start the journey to learn more about yourself so that you can improve for yourself and for the people around you. Thank you so much for that clarity, Doctor. You mentioned about medications right now. And to understand if a person should be taking medications along with it, to understand the kind of symptoms that lead to this journey of starting to take care of your mental health. Do you know of any very common symptoms that are found, especially in today's generation, which is very much involved in the virtual world, being a part of cyberbullying, and even in the physical environment, there are a lot of things that people go through which lead to certain symptoms which would help them recognize if they need a psychologist or a psychiatrist?
अगर ना रोज की बात करें, लाइक एवरीडे स्टफ एंड व्हाट पीपल आर गोइंग थ्रू, बहुत बहुत कॉमनली मैं जाऊंगी. थोड़ा मैं हिंदी में ज्यादा बोल रही हूँ, मुझे कमेंट से लग रहा है कि बहुत सारे हिंदी के लिए जा. आई एम कंफर्टेबल एनी हाउ. बहुत कॉमनली जो पेशेंट्स आके हमें प्रॉब्लम बताते हैं, दे आर जनरली अराउंड कि हमें बहुत घबराहट हो रही है, हमें एंग्जाइटी हो रही है, मेरे को नींद अच्छे से नहीं आती, मेरा काम में दिमाग नहीं लगता, या मेरे को साइड टाइम उदासी और खराब विचार आते हैं. सो दीज आर द जनरल टर्मिनोलॉजी जिनके बारे में लोग ज्यादा आके बात करते हैं. ऑब्वियसली ये अब हमारे ऊपर है कि हम उसके आगे कैसे हिस्ट्री लें, क्या आगे और सॉल्व करें, और फिर उसके हिसाब से क्या डायग्नोसिस बन के क्या दवाई या फिर थेरेपी साथ में क्या स्टार्ट करी जाए. बट जनरली ये बहुत, मैं कह रही हूँ, बल्क है चीजों का जो आता है. इसके अलावा जनरली अ लॉट ऑफ विमेन दे कम विद इश्यूज लाइक अराउंड द मेंस्ट्रुअल साइकिल, जो पीरियड्स के अराउंड, लाइक प्री मेंस्ट्रुअल स्ट्रेस. बहुत लोगों को पता है अब इसके बारे में, थैंक्स टू द इंटरनेट, की प्री मेंस्ट्रुअल डिस्फोरिक डिसऑर्डर्स होता है कि मूड फ्लक्चुएशंस थ्रू आउट द साइकिल कैसे रहते हैं. तो दिस इज व्हाट वी डील थ्रू ऑल ऑफ दिस. बट हाँ, साइकोसिस भी चीजें हैं जो थोड़ी हाई लेवल यानी थोड़ी एक्सट्रीम होती हैं, जिनके बारे में इतने लोगों को नहीं पता. तो छोटे बच्चों से लेके उनके बिहेवियरल डिसऑर्डर्स क्या होते हैं, टीनेज इश्यूज हैं, देन मैरिटल प्रॉब्लम्स हैं, ओल्ड एज इश्यूज हैं, एपिलेप्सी है, डिमेंशिया यानी भूलने की बीमारी है. तो range is infinite literally. Psychiatrist deals with so many stuff, and yes, a lot of people also do not know that ki de-addiction is completely a part of psychiatry.
Okay.
Psychiatrists deal with addiction of all sorts, de-addiction from alcohol or any kind of drugs. तो वो वाला भी पूरा एक सेक्शन है जो एक अच्छा खासा बल्क ऑफ पेशेंट्स उस चीज के लिए सीख करते हैं साइकाट्रिस्ट को.
Okay, okay. That's really helpful. So, like again, we would want to elaborate more on different ages and stages of life में, especially for like youngsters, you mentioned teenagers के लिए different type का stress होता है. Then for women, it's entirely different when it comes to also going through their physical journey. um, how would you help parents recognize something that kids might be going through, because it's usually our conditioning is such that it becomes very difficult for the kids to um, you know share with their parents what they're going through, and likewise how do parents make sure that they're healing from their own journeys and doing taking participating as a very healthy parent and making it easier for their kids to be more open about their mental health journeys.
Again, I would say thanks to the internet, a lot of people are very much aware कि अब बच्चों में क्या क्या issues आ रहे हैं. So they try and find out signs, and बल्कि sometimes they're very also over possessive when they bring out small stuff and we just tell them that it's normal. ऐसा बच्चों के साथ होता रहता है. But parents these days are very aware, and especially अगर हम छोटे बच्चों की बात करते हैं, like somewhere around below 12 years of age, there they have a lot of issues. Like if you are having school complaints that the child is not sitting at one place, they are breaking stuff, they're not going along well with other, and they are very impulsive or aggressive. So generally we do a diagnosis or test around ADHD, and we talk about things and they try to explain to the parents about autism क्या होता है, ADHD क्या होता है. सो मोस्ट ऑफ द टाइम या मुझे ऐसा लगता है कि बहुत सारा एनर्जी गोज इनटू साइको एजुकेशन, कि लोगों को पता नहीं है कि क्या प्रॉब्लम है, तो तब तक हम ट्रीटमेंट पे नहीं जाते. दिस इज ऑल्सो अ पार्ट ऑफ योर थेरेपी ऑल्सो, बिकॉज वेन यू आर opening up to the parents that this is something that is manageable and this is something that you will have, that ठीक होएगा, that ठीक नहीं होगा, तो थोड़े एक realistic expectation setting also happens for that stage. And then again, when we come and talk about teenagers, you understand a lot of relationship issues, body image issues, and then again, the thinking difference, the generational shift, जो parents से लड़ाई रहती है, peers में लड़ाई होती है. See, because again, we all know that teenage is that kind of phase when you are going through so much emotionally, physically, hormonal. तो बहुत सारे issues उस समय भी आ सकते हैं, specifically जब आज की generation में जब internet है. So it's a lot of pros, but a lot of cons for that generation also, because they are like मैंने body image disorder की बात करी. There's a lot of scope for them to see and learn, as well as to see and get insecure of. तो
Right.
हर चीज भी से कि बहुत moderation में consumption होना चाहिए. Then when we talk about mental health issues, most of the issues generally arise between 18 to 35 years of age. बहुत हार्ड एंड फास्ट रूल नहीं है ये, बट स्पेसिफिकली अराउंड इतना होता है कि इसमें मोस्ट ऑफ द इश्यूज स्टार्ट्स. यू गो थ्रू अ लॉट ऑफ हार्मोनल चेंजेस, यू गो इनटू कॉलेज, यू मीट न्यू पीपल, यू हैव अ न्यू जॉब, यू गेट मैरिड, यू हैव अ फर्स्ट किड, So a lot of life changes are also happening throughout this phase, which ultimately lead to adding of the stresses in life. And so these are generally the issues of anxiety, depression, and psychosis that happen during this time. As we start going above, obviously these issues can also be still there in old age, but also like in old age dementia, जैसे मैंने भी बोला था, भूलने की बीमारी होना, सामान रख के भूल जाना, ये नहीं पता कहाँ पे हो आप. So somewhere we start seeing the subtle signs around 55, 60 years of age in some people. And जैसे आगे आगे बढ़ते हैं, that can obviously escalate. तो इस वजह से भी उस एज में भी जरूरी है. So that's why I said in the very beginning, so mental health is not a destination, it's a very long journey. We have to start caring for it from the very beginning. I'll just give a very small example. Like imagine when we were teenagers, you and I, we must not have very, like being 13 and 14, we would not have heard things like this, oh, anxiety and all. Now it's very common for children to start talking about this stuff, and that is the big shift that we are seeing. That I would have learned about these things when I came into the field. But today people are that aware. I have so many teenage patients, both online and offline, who come with their parents and ask us to educate them also about the same.
Right.
So yes, it's a very process, and somewhere हम भूल जाते हैं कि environmental stressor is a very big stuff. It's not everything is genetic. Very roughly, I would say it's 1/3 genetic and 2/3 environmental stressors, give and take. So yes, there's a lot of change that's happening around us. Like COVID की बात कर लो, इतना बड़ा change. Hence there was this, again, either awareness of mental health issue became more, or people started having a lot of issues, and then there's again COVID stress, post COVID illnesses. तो वो सब भी हो सकता है.
जी. And now that you've mentioned the pandemic, ऐसा बहुत हुआ है at least 2020 के बाद कि बहुत सारी information है over the internet जिसमें काफी awareness increase हुआ है. There are communities that have been formed which are helping people to understand about their mental health. But like you also create content around it. बहुत सारे myths वगैरह भी create हो गए हैं. बहुत सारा सेल्फ डायग्नोसिस होने लग गया है. पीपल आर डायग्नोसिंग देमसेल्व्स एंड एक्चुअली नॉट इवन गोइंग फॉरवर्ड फॉर अ ट्रीटमेंट. Considering I wouldn't say that therapy or consulting a psychiatrist is expensive, because it's as important as physical health and we do spend some money there. But it's just something which is not a priority, because people think everything is available on the internet and maybe that would help them. Again, self-help books are also recommended, but every person and every individual is different. सबका अलग अलग तरीका होता है to understand their symptoms, to ask for help and to heal through what they're going through. So would you want to cover a few myths that you might have generally come across in your patients, जो काफी ज्यादा अभी लोगों में दिखते हैं, and maybe they can recognize and understand कि it's the best to consult a professional before you actually diagnose yourself?
इसमें ना थोड़ा एक स्टेप बैक लेके पहले मैं एक चीज और बता दूं. लाइक वी से दैट देयर इज अ लॉट ऑफ इंफॉर्मेशन अवेलेबल ऑन द इंटरनेट. फर्स्ट हैव टू बी टेक एवरीथिंग विद अ वेरी पिंच ऑफ सॉल्ट, दैट जो भी इंफॉर्मेशन है ये किस सोर्स से आ रही है. वी नो इंटरनेट इज फ्री एंड एवरीबडी इज फ्री टू मेक कंटेंट ऑफ एनी काइंड. So whenever you are having any kind of information, just go ahead on the profile and see the credentials of the patient. उस person के क्या credential है. Like मैं example देती हूँ, स्किन केयर है. अब एक स्किन केयर डॉक्टर बता रहा है और एक जना सिर्फ वैसा बता रहा है कि ये मैंने ट्राई करा और ये मेरे को अच्छा लगा. सो दैट डज नॉट ऑब्वियसली मीन दैट दैट वुड सूट यू टू. आप रिकमेंडेशन ले सकते हो, बट हार्ड एंड फास्ट वो नहीं पॉसिबल कि वो सब जनों पे सूट करेगा. एंड डर्मेटोलॉजिस्ट वुड गिव यू एन आउटसाइड व्यू कि ये क्लिनिकली है, ये टेस्टेड है, और ये ऐसा उनका पर्सनल एक्सपीरियंस, प्रोफेशनल एक्सपीरियंस, एंड प्लस लॉट ऑफ दैट ऑल दैट स्टडी दे हैव डन. सो दैट इज इंफॉर्मेशन यू कंज्यूमिंग. उसको एक बार देखो जरूर कि दे कौन रहा है. उसकी इतनी क्रेडिबिलिटी है भी देने की नहीं है. दैट इज ऑल्सो अ प्रॉब्लम विद दैट पीपल सी अ लॉट ऑफ थिंग्स ऑन द इंटरनेट एंड दे आर सेल्फ डायग्नोजिंग, एंड वो भी गलत है. बिकॉज ऑब्वियसली इतना जो जन के पास क्रेडिबिलिटी है, इंफॉर्मेशन है या डिग्री है उस चीज की, आप वो नहीं कर सकते सब कुछ खुद. बहुत सारे फ्री टेस्ट इंटरनेट पे भी अवेलेबल हैं. Again, with mental health, we do not have a blood test right now. या बहुत nascent stages पे. I cannot do a blood test and tell you like thyroid that this is the level and this is how much. कम है, ज्यादा है, या ये वाली दवाई दे दो या मत दो. So that is why we rely somewhere on tests as well as on history taking and your behavior, experiences, everything. That is why it's a time taking process. So first visit with a psychiatrist would somewhere take you minimum, I would say, 20-25 minutes for these. And this is assessments aside. This is just getting to know you better and why you are having that illness. Because जब तक हम रूट लेवल पे ही नहीं पहुंच रहे कि हो क्यों रही है, तब तक इट्स नॉट, कोई फायदा नहीं है कि तब तक हम जाएं और आगे बात करें इस बारे में कि ठीक कैसे होगी. So I make sure that people understand कि हो क्या रहा है, रीजन क्या है उसके होने का, एंड कैसे इसको सही करा जाएगा. तो एटलीस्ट दे शुड नो व्हाट्स गोइंग ऑन. तब ट्रीटमेंट की बात बाद में आती है. Now when coming to this, that yes, people are self-diagnosing, and then I also get a lot of people who diagnose and then they come and say, स्पेशली जो इंटरनेट पे आजकल मुझे चला ADHD का, सब लोगों ने बहुत अवेयरनेस हो गई, तो सब लोगों को अब आके बताते हैं ADHD है नहीं है. एंड व्हेन वी डू फॉर्मल असेसमेंट्स, वी डू दिस लॉन्ग इंटरव्यूज, तो हमें पता चलता है कि ये नहीं है. सो दैट इज व्हाई सी विद मेंटल हेल्थ, एज आई सेड, कि लॉट ऑफ सिम्टम्स आर मिक्स्ड. एक चीज दो तीन इलनेसेस में हो सकती है, एंड कैटेगरिकली ये पॉसिबल नहीं है कि बस ये एक चीज हुई तो मुझे हो गया. कि अगर मेरा कल एग्जाम है और मेरे को थोड़ी घबराहट हुई, तो ऐसा थोड़ी है कि मेरे को एंजाइटी डिसऑर्डर,
राइट,
एंजाइटी का मुझे इशू हो गया. दैट्स नॉट हाउ इट वर्क्स. सो यस, इट्स गुड टू हैव अ लॉट ऑफ इंफॉर्मेशन थ्रू द इंटरनेट. सब कंज्यूम करो, और अगर आपको ऐसे लगे कि इससे मुझे ये फायदा हो रहा है, इससे मुझे ये फायदा नहीं हो रहा, या ये चीज मुझे सूट कर रही है, या ये मेरे को somewhere around fitting me, then it's right that you have going with some kind of a homework, and then you can go to the mental health professional and ask. Yeah, you are better informed. So but yes, you have to somewhere take the help of a mental health professional, because वो देख के नहीं बैठ सकते कि हाँ मेरे को ये है. आई इवन गॉट सम पेशेंट्स की उन्होंने ये डायग्नोसिस अपनी बनाई, इंटरनेट से दवाई भी देख ली और वो भी खा ली. So that is very, very dangerous. That can lead you in a lot of side effects.
exactly, exactly. That helps a lot. I think हमारे ऑडियंस को भी इससे काफी मदद मिल रही होगी समझने में. So एक डाउट है जो बहुत कॉमनली आस्क्ड डाउट है, कि साइकोथेरेपी इज पॉसिबल ऑनलाइन, स्पेशली 2-3 साल से काफी लोग ऑनलाइन थेरेपी ले रहे हैं, गिवन कि उनके पास फिजिकली एक्सेसिबल नहीं है वहां तक पहुंचना, या कन्वीनियंट नहीं है, एंड टाइम और काम की वजह से. Do you think in psychiatry it is also possible to have an online appointment, since you mentioned कि हमें blood tests वगैरह की as such जरूरत नहीं होती है?
Yes, so that is what I say. COVID is I think the only silver lining that's come out of is this
Yeah.
teleconsultations. पहले भी
Yes.
होते, a lot of hard and fast guidelines came out, and now I think this is one branch where we are a little bit more comfortable than other doctors in taking online consultations. Because yes, doing is easy, and best thing about this is the stigma is nullified. There's a lot of stigma in moving out of your house and going to a psychiatrist clinic. किसी ने मुझे देख लिया तो, कोई मेरा नेबर ना देख ले, मेरा रिलेटिव ना देख ले, वहां मुझे कोई जान पहचान का ना मिल जाए. And that happens in a lot of clinical practice. If two people, like we have a multi-speciality setup, so if two patients, they have come to see a psychiatrist, they would run away to another doctor, they would run away to another, that we have come for chest checkup, we have just come for a routine thing, and they would not accept that you're coming to a psychiatrist. So yes, this is very beneficial that a person, when they like completely nullify the stigma. So if they need help, they take help from the comfort of their home. And yes, even with the blood test thing that I mentioned, we advise blood tests, we give prescriptions. Even if I need something, they can get it done at their local lab, any place nearest to them, and they can send us the reports for the same. So yes, very, very beneficial seeking psychotherapy, taking online consultations, especially with psychiatrists. Yeah, just as what I said, go ahead with whatever you have in hand right now. It's better to seek help rather than to just wait and watch and see what will happen.
True, true. I think covering all the technical aspects of mental health, we'll just come to the very basic question, which you also mentioned right now. To start with this journey, the first and the most basic thing is to ask for help and to recognize that you need help. Over the years, communities and social media platforms are making it easier for people to share what they're going through, but it's still a very big stigma in the society. Um, how do you feel we make it easier for everyone around us to talk about it more? And how do we make it easier for people to reach out to us when they need help? And we are able to ask for help when we know that we need it. Not even consulting a psychiatrist or a psychotherapist, but just to go ahead and talk about what we're going through.
The only way out is by lessening the stigma. The day we start equalizing this with the physical health, in the manner that if people are sitting at our house and we are just talking about ki, oh, I'm having diabetes, and other person says, oh, even I have a high blood pressure and I'm taking medicines for the same, and everybody just moves on from that, and it does not feel like a very awkward conversation. So similarly, the day we are able to equalize it or normalize it to that level, that आराम से बैठ के हम बोल सकते हैं, अरे मेरे को ऐसे ऐसे एंजाइटी की प्रॉब्लम हो रही थी तो मैंने डॉक्टर को दिखाया, अब ऐसे ठीक है, इलाज चल रहा है और धीमे धीमे ये चीजें मैनेज हो जाएंगी. And I'm not saying that's not happening. I would say in tier one cities, if I talk about Mumbai, Gurgaon, there are societies, there are circles where people are talking about things like this, and people are very open in saying that, oh, my therapist said this, or my therapist said that. So yes, change is coming, and that is the only way how we are going to make it easier for people to seek help. Because if I am able to talk about my issues or my problems normally, like with other person in normal social context, this gives other person also somewhere the courage to come out and say that, okay, maybe इनको हो रहा है तो मुझे भी ऐसी वाली प्रॉब्लम तो हुई थी, तो क्या पता मुझे भी फायदा हो जाए. So we just need to have the conversation going, and not just I'm saying in a social circle. Why not have it with your family? Why not have it with your partner? ऐसे ही तो normalize होगा when you're sitting together in family, and that is the issue a lot of people face कि मेरे साथ ही हो रहा है, but family ready नहीं है मेरे को ट्रीटमेंट दिलवाने के लिए. They feel कि ये तो टीवी देखने से हो रहा है, मोबाइल चलाने से हो रहा है, ज्यादा सोचने से हो रहा है, तो सोचो मत. It's not a machine. I cannot just turn it off and on. तो वो स्ट्रगल बहुत ज्यादा रहती है, स्पेशली टीनेजर्स की और यंग अडल्ट की, जो पेरेंट्स पे फाइनेंशियली, सोशली, इकोनॉमिकली हर तरीके से डिपेंडेंट है कि हेल्प लेने के लिए उनकी हेल्प चाहिए. So yes, we have to start normalization, and I say that media is playing a very huge role in this. We are seeing changes coming through web series, newspapers, news. हर जगह जब इस चीज के बारे में बात होती है, like this platform, like big platforms, news channels coming ahead and talking about these things, this has a far wider reach, and the more it reaches people, the lesser the stigma is. That is the only way, because जितनी awareness फैलेगी उतना लोगों को पता चलता है कि अच्छा ये प्रॉब्लम है और अच्छा इसका सॉल्यूशन हो सकता है.
True, true, very true. I think just as any physical symptom that we feel emotions, like we are happy and we are able to share that happiness with people, it should be as normal to share just another emotion, which is stress, sadness, or anxiety, or something as intense as depression. Um, while you were mentioning everything that you did in the last few minutes, there's something that I realized, which was there should be empathy in people while listening to someone. How much would you want to focus on that particular aspect when how much of an empathy plays a role in understanding a human emotion, and just making it so easy and normalizing the conversations around the people that we love and even strangers that we meet?
Absolutely. As I just said, we are just talking about talking. What about the person who's listening? अगर
Right.
सामने वाला सुन नहीं रहा है, या वो आपको उतने कंसंट्रेशन, इतनी अटेंशन, या फिर इतना ज्यादा उस पे जो कहते हैं ना वेट नहीं दे रहा है उस बात को हमारी, तो फिर ऑब्वियसली आई वुड नॉट हैव द कॉन्वर्जेशन अगेन. सो इट्स वेरी वेरी इंपॉर्टेंट टू, आई वुड एम्पथाइज हमेशा करना जरूरी नहीं है, कुछ सिचुएशंस में जरूरी होता है, बट अंडरस्टैंडिंग ज्यादा जरूरी है. Just to be a patient listener, just to be there in the moment with them and be like, I am here for you. You might not be able to completely relate to them, not able to completely understand what they're going through, but even if आप वहां पे हो और आप उनकी बात सुन रहे हो और समझ रहे हो, that is also very, जो कहते हैं मन हल्का होने वाली बात है. They feel very relieved that okay, if somebody is thinking or somebody is agreeing with what I'm saying. एंड उससे भी ये फायदा होता है कि इंसान सब कुछ अपने मन में नहीं रख रहा है. दे आर टॉकिंग टू पीपल एंड द पीपल एडवाइज दैट ओके, इफ यू आर गोइंग थ्रू दिस, so and so went through this and they went to this therapist and it helped them, they went to this doctor and they cured them or something like that. तो बात करने से ये भी चीज का बहुत ज्यादा फर्क पड़ता है. बट यस, टू गिव वी ऑल्सो हैव टू स्टार्ट रिसीविंग. तो एक पेशेंट लिसनर आई वुड से इज अ बेटर वर्ड या बेटर मीनिंग जो आप बनो, जरूरी नहीं है सब लोगों में एम्पथाइज करने की कैपेसिटी हो, डिपेंडिंग ऑन योर पर्सनालिटी, हाउ वेल यू रिलेट टू इमोशंस. बट इवन इफ यू आर जस्ट सिटिंग देयर एंड लिसनिंग टू देम, दैट्स आल्सो इनफ इन अ लॉट ऑफ केसेस.
Yeah, that understanding needs to be there. Even if you don't relate to it, you need to listen first and then understand what this person might be going through. So we've covered most of the questions. We would now want our audience to share any questions that they might have, and we'll address them. So, and you can take any question if you want.
I think there's been a lot of questions about masturbation addiction.
Yeah,
Would
yeah, there are.
seek personal therapy for the same. These things are very well manageable with a good therapist, as well as in some cases people require medications also for the same. So if you're genuinely having this issue and not just commenting for the sake of it under a video, please seek help. There are a lot of therapists available over the internet, and usually everybody has a link in bio. So yeah, go ahead and book a consultation for yourself. There are a lot of therapies like motivational enhancement therapies, um, behavior, like I just talked about, cognitive behavior therapies, which help in reducing addictions to behaviors also, not just about substances.
Okay, there is similar questions related to anger management as well.
Uh, for anger management, we also need to talk about why this is happening. Like I just said in the beginning, we are not just treating symptoms, we are treating a patient. एक पूरे
Right.
पर्सन ट्रीट कर रहे हैं. जब तक हमें यही नहीं पता चलेगा उसका ओरिजिन कहाँ से हो रहा है. So a lot of times, depending on your personality, it might be anxiety issues, you might be depressed, you might have some kind of an underlying personality disorder. Person may have a neuroatypicality, like I said, ADHD. So anger is just a symptom that's coming out. We need to go to the root cause and start treating that. The anger will itself go away. And a lot of therapy goes into understanding that what you are, how you take in emotions, and how you should respond to them, like better ways than anger to respond to the same.
Okay. There's one question related to how to manage grief. Yeah.
Sadly, it's through it, but yes, there's always better to have help during that time.
Right.
एक बहुत difficult process है. I would not just say grief like loss of a person. There could be loss of a relationship, loss of a job, loss of a lifestyle. Grief बहुत चीजों के लिए हो सकता है. उसके लिए भी therapy is very good, and if you start experiencing physical symptoms like insomnia, decreased attention, decreased concentration, not able to do your day-to-day activities, उसके लिए प्लीज हेल्प सीख करो. ग्रीफ के लिए भी जितना आप सपोर्ट ले सकते हैं उतना अच्छा रहेगा. बट यस, ग्रीफ में एक टाइम भी बहुत बड़ा फैक्टर है.
Right. So we'll be taking questions.
Psychiatry and government medical college, okay, 6 to 7,000 rank approximately.
Yeah. Glad we have some educational questions as well. So we will be taking two more questions and then we'll be concluding the session. One question was about how to differentiate between stress and depression, and then we'll come to the last question.
So stress is something that's happening in day-to-day life. No one of us is completely aloof of that. We experience stress with work, home, relationships, and everywhere. So depression is a clinical illness. It is बहुत छोटा करके क्रक्स में मैं बताऊंगी. If you are not feeling good, you feel sad most of the time, you're not having a good sleep, you're not able to do your physical, personal, professional work with the same intensity that you were doing before. Like उतनी प्रोडक्टिविटी नहीं निकल रही है, एंड बेसिकली जस्ट फील कि मैं अपने जैसा नहीं बिहेव कर पा रहा हूँ. अगर किसी को लास्ट 15 days में मोस्ट ऑफ द टाइम ये वाली फीलिंग चलती आ रही है, then it might hint towards being depressive. But yes, you need to have a personalized consultation to be completely diagnosed with depression. So yes, stress is not depression, and being sad is also not depression.
Yes, I think that is one question that needs to be understood more. So I think we're almost done with the questions. There was this last one about how to avoid procrastination and increase concentration. I think this question also, in addition, like I just like to add to it, people would have a lot of questions related to lifestyle changes and just the very basic daily habits that can lead to a healthier mind. So let's just address all these 2, 3 questions together, and then we'll be coming towards the end of it.
Yes, absolutely. So that's what I said. It's a journey. So it does not work like it, nothing is a quick fix. So yes, I would get very, very easy and few tips. Make sleep your best friend. I'm tired of saying this again and again. When we are very young, we do not realize the importance that sleep has in our life. It's a kind of reboot that your system and your body needs. Have a very good sleep hygiene, sleeping, waking up time approximately the same. Not using gadgets in bed, not eating food on the bed. एक थोड़ा वर्क लाइफ हार्मनी या बैलेंस जो भी आप बेटर बना सको फॉर अ गुड स्लीप साइकिल. अदरवाइज मोस्टली जो पेशेंट्स आते हैं वो पहली कंप्लेंट आती है कि पहले बस नींद खराब थी, उसके बाद ये सब हो गया. तो दे फील दैट इट्स बिकॉज ऑफ डिक्रीज स्लीप दैट दिस इज हैपनिंग, बट वी फेल टू अंडरस्टैंड दैट डिक्रीज स्लीप इज ऑल्सो अ सिम्टम. यस, इट कैन प्रॉब्लम जो आगे हो सकती है, बट वो भी एक सिम्टम है. क्लियरली इंसोम्निया एंड स्लीप डिसऑर्डर्स भी दिक्कत दे सकते हैं. सेकेंडली, हैविंग अ गुड डाइट. अब गुड डाइट में ये मतलब नहीं है कि हम कभी भी चीट फूड, जो सो कॉल्ड चीट फूड्स हैं, उसमें इंडल्ज ना करें. बट येस, मोस्ट ऑफ द टाइम हैविंग अ गुड healthy and nutritious meals, because you need your gut also to be healthy. A gut and brain are very, very strongly related. So whatever we eat reflects, like we say, with face, hair, everything. With exercise, बॉडी जो आप खा रहे हो वो इतना इतना ज्यादा फायदेमंद है. लाइक वी से जिम जाने से सारी बॉडी नहीं बढ़ती, डाइट उसके लिए देखना पड़ता है. सिमिलरली विद मेंटल हेल्थ ऑल्सो, विद फिजिकल हेल्थ ऑल्सो, डाइट इज वेरी इंपॉर्टेंट. क्या ले रहे हो? आर यू टेकिंग योर जो हम कहते हैं फुल न्यूट्रिशियस डाइट, योर कार्बोहाइड्रेट्स, योर प्रोटीन्स एंड द राइट अमाउंट ऑफ फैट. टू थिंग्स. थर्ड थिंग, अ गुड फिजिकल एक्टिविटी वट एवर इज एज योर एज एंड योर फिजिकल रिक्वायरमेंट आपकी हेल्थ जो अलाउ कर सकती है. सो ऑन एन एवरेज 15, 20, 30 मिनट्स का एक कोई एक्टिविटी जरूर होनी चाहिए, विच इज स्पेसिफिकली नॉट इन पीपल हु हैव अ वेरी सेडेंटरी लाइफस्टाइल, जो ऑफिस वर्कर्स जैसे हम लोग हैं, बैठ के जो ज्यादातर काम करते हैं अपना पूरा दिन, जिन्हें बहुत ज्यादा मूव अराउंड नहीं करते. तो एटलीस्ट 30 मिनट्स का कोई ये काम जरूर करो, एंड ग्रेजुअली यू विल स्टार्ट फीलिंग हाउ मच इट इज अफेक्टिंग योर लाइफ ऑन अ डे टू डे बेसिस. इसके अलावा मेडिटेशन कर सकते हैं, जर्नलिंग कर सकते हैं. हैविंग अ गुड सपोर्ट सिस्टम वो बियॉन्ड है, दैट इज वेरी, वेरी वैल्यूएबल. गुड फ्रेंड्स, फैमिली यू कैन अंडरस्टैंड यू, हु सपोर्ट यू, उसका कोई रिप्लेसमेंट तो नहीं है. बट यस, सीक help whenever it's possible, whenever you feel something somewhere is wrong, because there is no harm in it. उससे नुकसान कुछ भी नहीं होगा.
Okay. I hope that answers most of the questions that we have had. We also had a lot of repetitive questions, which we have already addressed in the session. And after ending the session, we will be saving the video on Dr. Rashi's page as well as the Better India's page. So you can always go back to it and ask questions. If you have more questions, you can reach out to Dr. Rashi, and she will be happy to address those questions for you. Dr. Rashi, we're just so happy and inspired that people like you, professionals like you, are making it a very safe space online as well as offline for people to share their issues and overcome their anxiety, depression, and any mental health issue that they might be facing. And we feel like if there's more of this that we are able to represent through our platform, we are happy to do so. So thank you so much for being a part of this live, and we're grateful for people like you to inspire more individuals to actually take care of their mental health. And thank you so much for being with us today.
Thank you so much for having me, and it's always, always a pleasure to spread awareness about mental health. And if anybody anywhere is feeling stigmatized, or you're feeling lonely and you feel something somewhere is not right, please, please, please seek professional help. We are not scary people, we are very normal people. And yes, this is a very, very safe space and a non-judgmental place where you can come with your queries and just go back being better. That is for sure.
Yes. Thank you so much, Dr. Rashi.
Bye, take care.